Hello, I'm Dr. Eve. Welcome to my sexual health store, which is within the Sexual Health Centre. Come in and visit us and come and shop around and become educated and informed about your sexuality using sex toys, which will certainly help and assist you to have a more pleasurable and satisfying sex life. I'm sharing a number of stories with you, stories that are common to you and common to me in my therapy room that cause a great deal of concern and a great deal of distress to many people. This is a story, a letter from a young woman with a very common problem. 33% of women have painful intercourse or pain with penetration. It's recognized and there are treatment programs are available. Listen to this woman's story. She says she's close to her wit's end, which is understandable. Her boyfriend and her have been trying to be sexual but have failed on numerous occasions. Whenever he inserts his penis into me, it feels like something inside me is blocking him from going any further. And when he goes far further or attempts to go further, it is extremely painful to the point where we have to stop. We've tried using lubricant, but it has not made it easier. What can we do to try and make it stop? Please, please help us. This is a young woman who is probably suffering from something called vaginismus. Vaginismus is a pelvic pain disorder, a genitopelvic pain disorder, in which the muscles that surround the vagina, hold up the pelvic floor and surround the sphincter of the anus as well, they go into spasm because of a psychological fear of a woman around being penetrated and experiencing incredible pain. Women who are more vulnerable to vaginismus are those who come from a very closed religious background or a fundamental background where there's so much tradition and so much fear and so much stigma associated with being sexual that they learn to shut down all their sexuality, all their sexual thoughts, and they have this tremendous irrational fear that builds up by the time that they are permitted to be sexual. So when the time for penetration comes and they give themselves that permission, they find that the muscles that surround the vagina just don't cooperate with what their head wants to do. They become so used to going into spasm that they find it very difficult to release themselves. These are women also who will start from early, being afraid of putting tampons in, find it very difficult to undergo a gynecological examination, and so with penetration it feels almost impossible. It feels, as she describes, that there is a wall blocking any kind of penetration. The treatment programs are available. It's a combination of therapy, which is what I do. I run groups for women who have vaginismus, which are very successful, together with a pelvic floor therapist who's going to exercise the pelvic floor muscles and teach you how to push your way through that pain by exercising and releasing the muscles. We then have a program of dilation, where you would start off with the smallest vibrating dilator, which is important because the vibration helps the muscles to expand, moving from a small to a medium to a larger size dilation, and finally ending up with smart balls, which you can insert and which will really wonderfully make sure that the muscles are exercised on a daily basis. You're going to do that together with liquid silk, which is a moisturizer to be inserted into the vagina before any kind of penetration or dilation, and of course using Peugeot lubricant, which is a great silicone lubricant to ease the entrance or the attempt of penetration. Vaginismus is a psychological difficulty. It is not a surgical problem. It is not a medical problem. So make sure that you consult a sex therapist as well as a physiotherapist as well as a team which includes a gynecologist to help you get onto a program which will really help treat this problem, which is very treatable. To find out more about sexual health, find me on Facebook and follow me on Twitter.